We all okay to start? Yeah. Good afternoon, everyone. As the Roman statesman Cicero said, the safety of the people shall be our highest law. This is the approach that we've taken since the pandemic was declared in March. Today, I can confirm that it is safe to move to phase 2 of the plan to reopen our country, starting on Monday. This has been made possible because of the considerable sacrifices that you have made to restrict the spread of the virus and protect others. Thanks to your perseverance in pushing back COVID-19, I'm also announcing an acceleration of the roadmap. Over the last few months, fear has exerted a kind of gravity pulling us down, but now we find there is hope lifting us up again. During this emergency, we've suffered as a country, lost loved ones, and changed the way that we work and live. We are making progress. We are heading in the right direction. And we have earned the right to be hopeful about the future again. Based on the medical evidence and the recommendations from NPHET and government reports on the economic and social impact of COVID-19, Cabinet today agreed to implement all elements of Phase 2 and move further along the roadmap, a Phase 2 plus if you like. We've also agreed to bring forward actions in the remaining phases. So there will now just be 4 phases rather than 5. Phase 3 is starting on the 29th of June and Phase 4 on the 20th of July with a 3-week interval as previously planned. Under the guidance of the CMO and other experts, we'll work out in the days ahead which actions will take place in each phase. But some measures like bans on mass gatherings may need to remain in place well into the autumn, as will general public health advice around hygiene and physical distancing. The Taoiseach and I informed the First Minister and Deputy First Minister of Northern Ireland about these decisions earlier today. As you know, I've always said that we would accelerate the reopening of our country, but only if it was safe to do so. Thanks to your actions, we have now reached that point, and with your help, we'll keep moving forward. So we all need to stick to what we've been doing right, washing our hands regularly, keeping 2 metres apart whenever possible, observing coughing and sneezing etiquette, avoiding crowded places, wearing face coverings on public transport, and self-isolating when sick. As we ease the restrictions and meet and interact more, this will become more important, not less. And while we are able to reduce the number of phases from 5 to 4, we shouldn't assume that we can move from one phase to the next. We have to keep doing what we've been doing right and keep the virus under control. I know that this has been a particularly difficult period for those who are over 70 and people who are medically vulnerable. And many have yearned to break free from cocooning, a term that I know some people find insulting rather than reassuring. But now there is cause for hope. From Monday, it will be permissible for people in this category to welcome a small number of visitors to their homes, although we're asking that physical distancing is still observed. Shops will also provide dedicated hours for those who are over 70 or in an at-risk group. It's important that people continue to avoid unnecessary travel. So our message today and for the next 3 weeks is to stay local. We recognise the difficulty that the 5-kilometre travel restrictions are having, especially for people living in rural Ireland. So from Monday, people can travel anywhere within their own county or up to 20 kilometres from their homes, whichever is the greater. It's planned to remove domestic travel restrictions altogether at the start of Phase 3 on the 29th of June. In the meantime, they remain legally enforceable by the Gardaí. We want people to stay local and to stay in their own county so that the virus is not reintroduced to counties that are COVID-free today. From Monday, groups of up to 6 people will be able to meet with each other indoors or outdoors once they keep 2 metres apart. And groups of up to 15 people can meet for outdoor sporting activities. Solitary workers can return to their workplaces, and people who can maintain a physical distance from others on a phased basis. However, working from home should remain the norm for those who can. Up to 25 people will be allowed to attend funerals of loved ones, pay their respects and grieve together. Public libraries can open on Monday. And there will be a new summer education programme for children with special educational needs and disadvantage, as it's now safe to do so. And Minister McHugh will bring proposals in this regard to Government next week. Outdoor facilities and amenities for children, including commercial ones, can reopen as well. Playgrounds, once supervised, can reopen on Monday, and outdoor camps for children can also be held once there are no more than 15 people mixing together. We believe this will have a positive impact on the mental and physical health of children in particular. Elite athletes can return to their training facilities, marts can reopen, and greyhound racing resume without spectators. We're also approving the reopening of all shops from Monday. It's important that the return to retail should not create crowding on public transport or interfere with essential workers trying to get to work. Therefore, the shops that are reopening, that is the ones that are not open already, will be required to operate staggered hours, opening no earlier than 10:30 a.m. and allocating dedicated time for elderly, vulnerable and at-risk people. Shopping malls can open on June 15th, provided only the shops open, and measures are taken to ensure that people do not congregate at benches, fountains or food courts, for example. Summer is not lost, and this can be a summer of hope if we keep the virus at bay. So Cabinet also decided today to plan for a return of the tourism and hospitality sectors on the 29th of June as part of a revised Phase 3. We want to see the return of domestic tourism in our country and the reopening of hotels, restaurants, hostels, caravan parks, galleries and museums from the 29th of June, making it possible also for bars to reopen if they serve food with table service only, and restaurants as well. Make it possible for us to explore our country as if for the first time and rediscover the beauty that is all around us. We also want places of worship to resume services again in Phase 3 with precautions. As our country opens up and we start interacting more, personal responsibility becomes more important than ever. We got into this fight against COVID together and will only emerge from it if we continue to act together. And we'll be reinforcing this message in new public information campaigns over the coming days. So this afternoon, let me end with the words of a wise man, some words of hope. In the end, it's only a passing thing, this shadow. Even darkness must pass. A new day will come, and when the sun shines, it'll shine out all the clearer. So thank you for your hard work, your choices, your perseverance. That new day is now approaching. Thank you very much.
Thank you, Taoiseach. I think this is around the 8th time that I've stood at these podiums with the Taoiseach and with colleagues, very often to deliver stark messages about the implications of COVID-19 for all of our country. And today, thankfully, is a little bit different, because today is a day of hope. It's certainly not a day of elation, and it's certainly not a moment where we can say mission accomplished. But we can now see the chance to take back our lives from the grip of this virus. Today we can take some further, tentative but not insignificant steps towards a more normal society and economy. And we do so together, as we've done everything together so far on this journey. Without unity of purpose, there's absolutely no doubt in my mind we would not have arrived at this point. Because though we've been separated, we've never been divided. And though we've been apart from each other, we've never been closer. In the next stage, though, we do become even more interdependent, not less. It's as we take these next steps that we have to take the greatest care. It's as we begin to gladly and thankfully see more of each other that we need even more to protect each other. We know the toll this has taken so far, most of all on those who have lost loved ones, and we think of each and every one of them today. But today we can begin to hope again as a country. We can begin to look forward once again. For all of us, we can now, from next week, go a little further from our homes while staying local. See a few more people while staying distant. Go back to doing some of the simple things we've so missed while doing them differently, cleverly and carefully. While we've all been affected by this pandemic, I think it's fair to say that children and older people have perhaps found it harder than most. Deprived of close companions, simple pleasures and dearly held routines, missing each other. For people over the age of 70 and for those with medical conditions, we've asked an awful lot of you. You've shouldered those challenges with great difficulty and great courage. So now, whether it be a cup of tea in the neighbour's house or having some of the family over for dinner, or the long-awaited and much-needed reunion of grandparents and grandchildren, I hope that today's measures will bring some relief. For those who have loved ones living in nursing homes, we're also introducing a series of recommendations about the phased reintroduction of visits so you can again see your loved ones. For children, the summer that seemed stolen can now start somewhat to return. You can now visit playgrounds, maybe go to a summer camp, perhaps start your sports training again. For children with special needs, we're planning some measures for you too, including some additional activities over the summer months. So to children watching in on this who have been from the start, let me say this to you. I know this hasn't been easy on you. I know it's been really hard without your friends and without your school. But I promise you this. If you continue to listen to your parents and listen to doctors, listen to Dr. Tony and indeed Dr. Leo, you'll be able to do even more in a few weeks' time. I know it's not everything you want, but it is a start. It will continue to be a challenge. But because we've been able to get this far, we know we can get it right in the next phase. We will need to embrace the public health measures with the same vigour as we did right back at the very beginning. Washing hands, coughing and sneezing properly, keeping our distance, staying local, avoiding crowds, being vigilant for the symptoms of COVID-19, things you're probably sick and tired of hearing us saying, become even more important. And there's also some newer behaviours we need to get used to. We've already advised the wearing of face coverings on public transport and in shops. And today we're also recommending face coverings for people visiting or being visited by those who have been cocooning, for those visiting people in residential care facilities and in indoor work settings where 2 metres distance is difficult to maintain. These behaviours, these public health measures, are the first line of defence in a more open and more mobile country. Our personal behaviour is our safety net in a world and a country where this virus is still very much present. We know our actions will determine the course of this virus. They have from the start. And we know our actions can steer us to a better tomorrow. We've been in this together, and the only way to safely get out of it is together. We've proved we can suppress the virus, but now we do face another test. Over the next 3 weeks, we must prove we can live alongside it and keep it weak at the same time. But if we do it, the prize is great. We can move to the next phase with more ambition, more hope, more freedom. But to do so, to get there, we must remain careful, cautious, vigilant and together. Thank you.
Good afternoon, everybody. As we continue our fight against this pandemic, the efforts of our people and businesses have ensured that this is a fight that we can and will win. All across society, people have adjusted to the new reality, and because of this, we can continue to move away from the limitations that the virus has imposed upon us. It has been a particularly difficult period for retail businesses. The sight of closed shop fronts and deserted streets in towns across the country has highlighted the devastating impact of the virus. Thankfully, from Monday, that will change following the decision by Cabinet today that all retail can return as part of Phase 2 of the easing of restrictions. Overall, the wholesale and retail sector has the largest share of employment at 13.1%, so it's safe to return to work will be a significant boost to the economy. In terms of retailers in shopping centres, we have heard their concerns and we had a good discussion about it at Cabinet. We have agreed that it isn't fair to make them wait several more weeks or months before opening, while their competitors on the main streets can start trading again from Monday. Of course, the fact is many shopping centres are currently open and facilitating access to grocery, pharmacy and essential retail stores. However, there are legitimate public health concerns around people congregating in confined spaces. So we have agreed that certain adaptations should be made to shopping centres before reopening, including closing off communal areas and removing seating. This will mean that a trip to the shopping centre will not be a day out or somewhere to hang out with your friends. You will need to queue, go to the shop you want and leave. My department has prepared specific guidance in this area through the NSAI, which we will finalise with the HSE in the coming days before publication. For this reason, and to allow time to make the necessary adaptations, the reopening date for retailers in shopping centres will be Monday, the 15th of June. We have every reason to be confident that the retail sector can return to work safely. We must remember the staff and frontline workers in grocery shops, supermarkets, pharmacies and filling stations who have remained open throughout the pandemic. They have kept our shelves stocked and food and medicine in our cupboards. And most importantly of all, they have done it safely, protecting staff and customers. I also want to acknowledge the Irish people who have complied strongly with the public health requirements. We never thought the day would come where we would have to queue outside our supermarkets and chemists, but we have all learned to adapt, show patience and keep our distance. That is what has helped us to this point, and it must continue. It is vital now that retailers that were closed over recent weeks ensure that they can implement the National Return to Work Safety Protocol before reopening. The Health and Safety Authority are there to offer advice and guidance now and in the coming weeks and months. We are also asking retailers to stagger their opening and closing hours to facilitate reduced capacity on public transport at peak times. In terms of support to help businesses get back on their feet, I would encourage any small retail business who now has the certainty that they can open on Monday to do two things. Apply for the government's Restart grant, which has a minimum grant of €2,000 available and a maximum grant of €10,000. Go to your local authority website today. It's a simple one-page online application, and that's a direct cash grant into your bank account. The second thing you should do is get on the wage subsidy scheme. And I know from speaking to many small family-run retailers who may only have 5 or 6 staff who might have opted to go on the pandemic unemployment payment at the start of the crisis. If those businesses' turnover has been 25% impacted by COVID, they can get on the wage subsidy scheme now. That's essentially a grant from government every week to pay up to 85% of your staff's wages. Wages are the biggest cost for any business, so that cash injection by government will immediately free up cash flow for other areas of your business. On that note, I'm very pleased that Cabinet has decided to extend the wage subsidy scheme until the end of August. It has been a vital support to businesses and workers over the last 3 months, and will be equally important as we continue to chart our course to recovery. In terms of ensuring businesses operate safely, I am confident in the work of the HSE in ensuring compliance with the Return to Work Safety Protocol. At the start of Phase 1 of the roadmap on the 18th of May, they began a national programme of inspections to check compliance with the protocol. Up to the middle of this week, over 1,000 inspections had been recorded by the authority. I'm also pleased to confirm that Government has today agreed that their work will now be supplemented over the next phase by more than 500 other inspectors from across the system. The additional numbers will be provided across the regions by the Workplace Relations Commission, inspectors from my own department, the environmental health officers working with the HSE, and inspectors working with the Department of Agriculture, Food and Marine. As we move into Phase 2, we must also be mindful to continue to do the things that have served us well up to this time. When we return to the High Street next week, it will not be the one we left behind. The shopping experience will be different. Be prepared to queue. For many of us, leisurely browsing will have to be replaced by purposeful direct shopping. Above all else, show personal responsibility and be respectful of other customers and staff. I would also strongly encourage customers to shop local and support local businesses. This has been a very difficult time for small businesses, so please support them and play your part in helping them to get back on their feet. So my advice is stay local and shop local. As we progress to Phase 2, I'm more confident than ever that we will prevail over this pandemic. Today is a day of hope and optimism, but not complacency. We need to stay patient, vigilant and resilient, just as we have done since this started. More of the same is now needed. Thank you.
Right time to accelerate? Why is now the right time to accelerate the roadmap? You've been taking a slow and steady approach up until now. And also a question for yourself and for Dr. Houlihan. Is what the government announcing today, does it deviate from the advice that you have given?
Why now? If you remember going back to the start of this, when we published the roadmap, we said that we'd adopt a slow and steady approach, but would accelerate it if it was safe to do so. Because we always wanted to have a plan that we would be able to accelerate rather than one that we had to pause or slow down. Why is now the right time? Really a number of reasons, because the data is going in the right direction. The R number has stayed well below 1. We see a onward downward trend in the number of new cases, the number of people in ICU, the number of people hospitalised with COVID, the number of deaths being reported every day. And also we've been watching the experience of other countries that have eased restrictions before us. And we've seen there that in those countries, while in some cases there have been small outbreaks, clusters, no major need to return to lockdown. So all those reasons put together gave us the confidence that we could go to Phase 2, or Phase 2 plus, which is what this really is, and reduce the number of phases from 5 to 3. But more and more, the message is going to be less about government rules and more about a long-term change in the way that we live our lives and the way we interact with other people. And that is all of those things around hygiene, physical distancing, wearing masks in certain settings, isolating if you're sick. That's what's really going to be the most important in the future.
And what about then is there any deviation from the advice that you gave?
No, I mean, this is, you'll see it, there's a detailed document that runs to over 10 pages accompanying the letter that we write in the usual way after each NPHET meeting to the Minister, and the Minister brings to Cabinet, that sets out the detail, both what we provide for in terms of the advice and then the rationale behind it. And it was advice that we provided that on the basis of our assessment, and the Taoiseach covered it there very clearly in terms of where we're at in terms of disease transmission, the evidence that we see in terms of the impact of that disease, the evidence we're seeing in terms of the impact of the measures that are in place in terms of restrictions, and then also the experience that we have observed in other countries. So for the most part, the advice on which the roadmap is based was put together based on our understanding and observations back in April. At that point in time, there had been no country that was in a space of easing restrictions, and there was nothing to base any observation of that on. We've had that experience now, so just because of the progression of the disease across Europe, it has arrived in Ireland slightly later than other countries. They've been in a position to ease restrictions at an earlier stage than us, and we've been in a position to observe that. And with a small number of exceptions, for the vast majority of countries across Europe, which has been the epicentre of this infection, at least until recently, a mixed combination of easing of restrictions has been followed by a continued downward pattern in terms of the impact of the disease, the occurrence of the disease in those countries. And so that all gives us assurance, if you like, in terms of the public health rationale for the pace, the nature of the restrictions. And so we reassessed all of this at our meeting of the National Public Health Emergency Team yesterday and set out the advice that we thought we could move to bringing the next 3 phases into 2 phases.
I think it's fair to say, from the very start of the pandemic, going back to March, the advice from the public health experts and political decision making has been aligned. We've kept it that way. We want to keep it that way. I don't think we'd be in a good place in the country if Tony was at one press conference giving one set of advice and then the government was at a different press conference giving a different set of advice. That would not be in the public interest to be in that position. So we've always kept government decisions aligned with public health advice. But that's not to say that it's that there isn't an exchange of views. There is, and there's modifications, and there's a very sensible process around all of that. So one thing you'll see in the letter when it's published later on is the advice from NPHET was to keep the shopping malls closed for longer. But there was a reason behind that, and the reason behind that was that we didn't, or rather they didn't want people congregating in an enclosed space, which is a shopping mall. We found a way around that through the NSAI guidelines and a week to be put in place for that to happen. And similarly with the 20-kilometre rule, the point behind the 20-kilometre rule is keeping people local. But we've heard what a lot of people have said to us, particularly in rural areas, that 20 kilometres, if you live in Dublin, might get you to anywhere in Dublin, but it wouldn't get you potentially from Westport to Castlebar. So that's why we've agreed with NPHET an approach that is a double approach. One, allowing people to stay in their county or within 20 kilometres of their home, whichever is the greater. But the principle, the public health principle and the common sense principle behind that remains intact, that we want people to stay local. We do not want people to be undertaking unnecessary travel, at least for these 3 weeks. And we want to make sure that in those counties where there are now no cases and haven't been cases in ages, or at least for days and weeks, like Wexford and Sligo, we don't want those counties to be reseeded by people coming from Dublin or other parts of the country where the virus is still in the community.
Could I just add, just in the interest of clarity, and you'll see this in the CMO's letter to me, I mean, the recommendation to merge, if you like, phase 3, 4 and 5 into 2 phases is an NPHET recommendation. The additional measures that we're recommending in relation to children and older people also are NPHET recommendations as well. So I think, as the Taoiseach said, when it comes to alignment, I think you'll see a significant amount of alignment. But obviously then we have to take that advice and make sure it's applicable and sensible and operational.
The idea of air corridors being implemented, would that be July the 20th, the new final phase? When do you see hairdressers opening? And Dr. Houlihan, I understand yesterday at the meeting you raised the prospect of a review, maybe on the 2-metre advice for the hospitality sector. Is that an idea that will be explored in the weeks ahead?
Yeah, we don't have a date in mind yet for air travel to resume or for any air bridges to be agreed, but we are very much observing what's happening in other European countries where air travel is resuming between countries where there is a low incidence of infection. But we do envisage people being able to engage in domestic tourism from June 29th. No date yet on air travel, so I'd encourage people not to go booking flights or anything like that just yet. That would be premature. On things like hairdressers, barbers, nail bars, all of those things, those personal services, I think everyone would really like to see them open as soon as possible. But again, as of now, that remains in phase 4. And that is for a very good reason. Everyone has been to the hairdresser, has been to the barber, understands what that involves. It involves being in close contact, almost face-to-face contact with another person for half an hour, even longer. And that makes it a relatively high-risk engagement. So over the next week or two, led by NPHET, we will redefine those final phases, 3 and 4. But as of now, the date stays the same.
Yes.
On the 2-metre advice, will there be any review of the 2-metre advice in the hospitality sector or elsewhere?
So it's not the 2-metre advice. So what we did was to say we will do some work to develop some guidance on social distancing requirements in the hospitality sector during periods of very low transmission. And again, and just take the opportunity to stress that it's the totality of public health advice and how each of the pieces interact with each other that influence the risk of transmission of the virus. It's not one particular measure. I understand there's been a lot of focus on 1 and 2 metres. We don't believe that the evidence exists for us to recommend less than 2 metres as the social distancing requirement. But it's how the whole lot of the pieces of evidence or advice interact with each other that deals with the risk of transmission at a point.
That advice has changed in the next month
So
or so.
we're going to develop guidance for this specifically for application in the hospitality sector, which will set out how it should be interpreted.
So, but it won't be the case that it could come down from 2 metres in the hospitality sector.
So we'll set out that guidance and advice for the hospitality sector in the guidance, which we'll work on over the next number of days.
And it wouldn't apply to schools, for example. There'll be no,
No,
guidance
no,
there.
this is the hospitality sector. Schools are not in the hospitality sector.
Next question to Gavin Riley. I have a few questions, but hopefully they can all just be short enough answers. Firstly, for households that are visiting others, you've permitted now that it can be groups of 6 that visit. What do you consider to be a permissible short visit? Is there a guidance on how long you would consider to be appropriate? Does the advice on those who are cocooning and their ability to take visitors now, does that also apply to people who might be inpatients in hospitals, because there are some people who'd like to get visits there? If shopping centres are allowed to open on Monday week, that's obviously a week between phases. So does that not slightly undermine the logic of having 3 weeks between phases, because you can't fully assess the transmission of the virus in between? And finally, does the decision to allow full travel within county boundaries not completely confirm, really, that travel limits are somewhat redundant? Because much as those people would like to do it, you have people now in County Cork who'll be able to travel 200 kilometres freely and permissibly under the regulations. Does that not really sort of make the case that travel limits are now going to be impossible to enforce and are therefore redundant?
A lot of questions there. Maybe I'll take 2 on the shopping centres and the travel limits, and maybe ask Tony to speak on the other matters. Just in relation to the shopping centres, we have always gone for 3 weeks.